another question, 7, Anthony from Vancouver again. Anthony's, I did the same Anthony, a lot of different Anthonys in Vancouver. Anyway, since health is largely handled by the provinces, what have been some of your biggest challenges when coordinating with your provincial counterparts any of the COVID-19 precautions, testing and tracking during this pandemic?
Well, it's a great question, Anthony. And I think the challenge for the federal government is that we don't deliver healthcare. It is the responsibility of provinces and territories, and we're there to help them, achieve their responsibilities, but we don't deliver it. So it's been really frustrating in some ways when, as the federal government, we have very limited tools. I always say this is what I can provide as the federal health minister: money, advice in the terms of guidance, and equipment, and that's the challenge. Now, having said that, Dr. Tam works really closely with all the medical officers of health across the country, and they have something called the Special Advisory Committee, and that's how that guidance gets created. So, I think that has been an aspect of good coordination. The challenge is, of course, at the political level, right? If we have political leaders that don't take the virus seriously, don't act quickly, don't, impose restrictions that need to be there when cases are too high, then we see real significant challenges and death, actually. And, yes. The reality is this is not the time to be playing politics. I always like to say, it doesn't matter if you don't believe in the virus believes in you. And I think this is really important. And, we have research, science, and evidence that suggests that the less we move about, the more we can protect ourselves from this virus. Nobody wants to do it forever, but we have to do it for a few more months.
And I think you're right about the politics, not politicizing this issue, because the thing about COVID-19 is that it behaves the same way in Paris, it behaves the same way in Sydney, Australia, it behaves the same way in British Columbia and in Prince Edward Island. And therefore, we know how it behaves, we know how it spread, we know what it can do, and therefore we know how to protect people, how to contain spread, and to do all of those things. So the science is the same everywhere. But when politics enters it and people are ideological and don't listen to the science, that's when Canadians are put into jeopardy. And that's when things start falling apart. And I think that that's really, really important for everyone to remember, that it is, as I said, the virus never read the Constitution, doesn't know anything about federal, provincial jurisdiction. It doesn't know anything about borders, and it doesn't care about borders. And so but it acts the same way everywhere, and it causes the same tragedy everywhere. And we know how to prevent it, and we know how to protect ourselves from it, and we should just listen to the science. And this is where, because you said at the very beginning, you do not believe that you as a politician, and all politicians should be making these decisions. You are guided by what your public health officer tells you, by what the science tells you, by what you're advised about the science. And I think this is something to bear in mind and to remember at all times, to trust the science, because it is really important.
We have no other way out. I mean, we science has saved us time and time and time again in medicine, right? I mean, medicine is based on science, and we all know that the science evolves. I mean, things change. We learn more. COVID-19 was brand new to the world in December, January, February, March, but we're gaining more knowledge. To your point, what does it behave like? What is it like? What doesn't it like? How do we, defeat it together? But honestly, it is science that's going to show us the way. And it's science that's developing the vaccines. I think there was a question about what investments we're making in science and research. Over $1 billion we spent on research and science for COVID-19 alone. And yes, that, just indicates our government's belief in science and research, but also our support of it. And, I'm so glad that we made those changes in the last mandate where we boosted capacity for researchers and scientists around the country. Can you imagine if we had been starting at less than zero?
Yeah. No, I think that is really, really very important.